You are watching The Wellness Hour, the most watched medical television talk show in the world. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. Big topic, hot topic. With us we have board-certified plastic surgeon, artist, Dr. Mo Zakhireh. Dr. Zakhireh, always a pleasure to have you on the show.
Thank you, Randy. Good to be here.
Now, before we get into today's topic, I always feel like everybody knows you, but for those that don't, tell us a little bit about your background, your training, and CSI.
Okay, I did my general surgery training at Harbor UCLA, which is the county hospital for the UCLA system. And then I did my fellowship at the University of Utah in plastic surgery. Okay. And then they were kind enough to ask me to stay on. They recruited me as a staff member. So I was on faculty there for almost 5 years as a professor of plastic surgery. I taught the gamut of plastic surgery to medical students and residents and fellows.
Do some guys have it and some guys don't? By the way, as far as an eye, an aesthetic eye to make something look beautiful?
Yeah, you have the guys that are very academic and they stand there and they draw lines and they mark the patient, and and then you got the guys that sort of freehand it, and they have a vision and they can make it
look the way they want it to.
Yeah, and then I was recruited to the desert, and I eventually joined Dr. Ball's practice at the Cosmetic Surgery Institute.
Big place, big place.
It's a 6,300 square foot building. We have 2 operating rooms which are double certified by different accreditation
so it's
bodies.
safe. I mean, safety is big on your list.
Absolutely. We don't skimp and we don't cut any corners.
Now, you do everything there, by the way. We're having you on the show talking about breast augmentation or breast surgery today.
Right.
But I mean, you have IPLs, you have lasers, you do fillers, you do everything.
You bet. We have a full gamut of lasers. We have 2 very talented estheticians.
Yeah.
And we have a wonderful laser nurse, very, very knowledgeable about what she does. And we have a great injector nurse, Peggy, who does Botox, Restylane, you name it, she does.
Okay, breast augmentation, breast surgery, what are the different categories?
It's a very interesting thing. In our practice, we have the younger patients who come in for breast augmentation. They're smaller and they just feel like they want to balance out their body. And then we have a little bit slightly older patients in their 30s who have had some children, and now because of breastfeeding, their breasts have fallen, so they want to fill it back up.
So breasts have become more mainstream. People that I guess were afraid to do it in the old days or wouldn't do it, swore they would never do it.
Right.
Are doing it.
Absolutely. And I think what happens is all the controversy has settled down with silicone
controversy
implants.
About what? Oh, silicone.
All the silicone, hubbub that happened, the silicone leaking and things like that.
We had a silicone implant on this show. They cut it. The surgeon cut it.
Right.
It doesn't come out.
Absolutely.
Is that?
And that's the key.
People don't know that, I guess.
Because the silicone particles have actually been bridged by extra oxygen molecule. So all the silicone is clumped together. So the leakage has been taken out of that factor. Even if, God forbid, I always tell my patients, if you get involved in a car accident, you hit the steering wheel or airbag deploys, hits you, and your implant cracks under the pressure, you'll never know it because that silicone doesn't leak. It stays right there. So it's very important.
I asked you right before we went on, what's the percentage of patients do you do silicone over the, what do you call the other, by the way?
Saline.
Okay.
Saline.
You said 99%.
Saltwater implants. 99% of our implant breast augmentations now are with silicone. And the things that I tell my patients during consultations, the patients haven't heard anywhere before. I mean, I really open things up for them. I take them to the next level. And we have a lot of patients that come and visit us from all over the country. And they come back a year later, I've gone to the best breast augmentation surgeon, on the East Coast, on the West Coast, in Canada, here, there, and I'm back to you. A year and a half later, everything that you told me makes sense. I went and did
There
my
is
research,
a lot of art to it because I'm still skeptical. I still feel, after, on our show airs nationwide, we're in Canada, we just launched there, but it seems a straightforward procedure.
Yeah,
but it's not, you're saying.
Well, it's so funny that you mentioned that because all my friends, they're like, oh man, you got the best job, you just go in and put in the implants, boom, you're done, and you can go home or go play golf or whatever.
Yeah.
No, that's not true. What happens is there's a lot that goes into these implants, and there's a lot that goes into the art of it.